We're here today with Jeff Neal from Westside Rolfing, structural integration. Now, Jeff is a rolfer. That's kind of a funny word, a rolfer, rolfing. How did that come to play? What is rolfing?
Well, Rolfing is a manual therapy that aims at balancing and restoring alignment to the body through manipulation of the soft tissue, also called the fascia. So it's the soft tissue. We don't do any joint manipulations or bone work. It's all on the soft tissue.
So how did they get the name Rolfing?
Well, Rolfing was started by a woman named Ida Rolf about 50 years ago. And I think they just wanted to take her name and tie it to her work. It originally was called structural integration. And I think to give her credit for coming up with the modality, that they tied the name to it. And then they added the 10 series work. I think it was a great marketing tool. I think they said, hey, 10 series is better than 7, so it sounds better.
Okay, so you said 10 series. So there's a whole process, and you start with the first one, and every series that you do is at a different part of your body. How does that work?
Well, the 10 series is based upon like a systematic breakdown of the body. We do different body parts to allow the body to integrate the work and to open up so the next session we can be successful with. For instance, the first session is a outer body work. So we do the legs and the hips, the shoulders and the arms and the neck. And then the second session, we go to a completely different part of the body, which is the lower leg from the knee down to the feet, to allow the body to be able to handle being on the ground, opening up. So it's kind of an outside-in process, and it's very, very effective. If you go to the website of the Rolf Institute, they say that over 1 million people have tried Rolfing and have had successful sessions with. It's very, very effective. Part of the Rolfing work, the reason why I think it actually resembles almost like a physical therapy appointment, is that we do lots of assessments. So we start off looking at you, a whole body shot, looking to see how your tissue lies and the way you're pulled in different directions. And we look at how you walk, how your joints move, little joint mobility assessments, and then actually movement assessments. How do you sit? How do you squat? How do you reach behind your back? Where are things tied up and really, really tight? And then we can know where we need to work. What's also different about Rolfing from, say, massage is that we'll do those in the middle of the session as well.
So you brought up the massage. What are some of the differences? I know a lot of people think of Rolfing and think maybe it's just a deep tissue massage. What else is Rolfing compared to a massage?
It's misleading, I think, to call it deep tissue massage. I would call it Rolfing, structural integration. It's totally different. Rolfing didn't evolve out of massage, and we're not really interested in how deep something is or how light a touch something is. We just want to get results.
Anytime that I've mentioned Rolfing, a lot of people say, "Oh man, that really hurts." Is it painful? Does it have to hurt?
I like to rephrase that. I'd like to say it's intense versus painful. I think the painful connotation drives people away from trying out this really fantastic alternative therapy. It gets into people's mind and they immediately turn it off. It can be painful if you want to look at it that way. If you've got 45 years of abuse on your body and you need to have something worked on, and if it's very, very deep, it's probably going to be uncomfortable. But I would try to stay away from the word painful. I'd rather use the word intense.
I've been Rolf for many, many years, and it absolutely changed my life more than anything I've ever done. I was getting chiropractic 2 or 3 times a week. I was getting massage, acupuncture, and the next day I felt exactly the same before I got the treatment until I get Rolfed. I went through the 10 sessions, and then I go back every month just to get different tune-ups. And you work on different parts of my body, and it's changed my life more than anything.
Your story is very similar to mine. I had a skiing accident, injured my shoulder, and did a surgery, did all the physical therapy that I could do based on my insurance. And I developed, once I was released, a pretty big neck dysfunction, and I couldn't move my neck without pain, and my shoulder still was continually giving me problems. And I tried, as you said, all the different modalities as well, and none of them worked until I tried the Rolfing. And within 3 sessions, I was really moving better, and I had a lot less pain. And by 7 sessions, I decided I wanted to do this for work.
Wow, very, very cool. So who would be one of your ideal clients? Who would really benefit from Rolfing?
I think the most ideal kind of client for me is somebody that's a proactive thinker who will get in there and do things on their own to help the work stick. Someone who is fairly healthy. I don't think Rolfing is for really, really sick and unhealthy people. I just don't think their bodies can handle the work that's being done. So for me, the people that I've had the most success with have been weekend warrior athletes, really active people. I've had a few younger kids who are athletes come in. And then basically just in general, people who want to take ownership of their health.
I know Rolfing is getting much more popular. So many people are doing it because of the benefits.
Right.
So what makes your practice different than somebody else? Tell us a little bit about you and why you're doing what you're doing.
I was a client before I became a Rolfer, but I've been in medical imaging for the last 25 years as an X-ray tech and then a CT and an MRI tech. And I think what differentiates me from a lot of other people in alternative therapies is that I have perspective from the patient/client's perspective. They get to run around when you go into the medical situation. You go see the doctor, you get 15 minutes of time. They give you a prescription for some pain medications, or they send you to the physical therapist for 2 or 3 things, and then they send you on your way. There's no support, and there's a lot of times a lot of failure within compliance. I think for me, I really like to help people. I know where they're coming from. I spend time, that 75 minute to 90-minute time period when they're in my office, my attention is on them. They're the person that's getting the work. They're the person that's there. I'm there for them. That's really, really important for me. If you come see me, you're going to be taken care of. I mean, you're the forefront of my attention. There's nothing else.
So where are you located at?
I'm located in Golden, 1800 Jackson Street, Suite 212, right down from the high school.
So Jeff, when somebody's ready to change their life, what is the process? How do they get a hold of you?
They can get a hold of me via email or via phone, or they can go to my website and actually schedule an appointment right there at westsiderolfing.com. I encourage people, though, if you do have any questions or apprehension about the work, is to give me a call and we can talk about Rolfing and answer any questions that you might have.
I'm sure they're going to benefit tremendously.
I hope so. That's the plan.
Yeah. Thanks so much, Jeff.